Hello, and welcome to Keeping It Real with Shannon live. Because you don't know how it's going to turn out. My kids empowered me to get out.
What's going on with this remote learning in the midst of COVID?
Working for different elected officials, learning and understanding how to put the community first.
Hi, and welcome to Keeping It Real with Shannon. Thank you so much for joining us. Tonight, we have a special and very important topic that we need to talk about, and that's dealing with a stroke. So we have a guest coming on, and we're going to introduce her right now and bring her on so we can get started with this hot topic. Hello there, Dr. Vanessa.
Thank you. Like you forgot about me? It's okay. Well, we got a very important guest tonight, and I'd like to bring her on as soon as possible to get all the information regarding stroke. Our special guest tonight is Miss Kristine Deblois-Ortiz. She's an RN, MSN, SCRN, and the Stroke Program Manager for Neurosciences at New York Presbyterian of Queens. Let's welcome to the show.
Hello there, Miss Ortiz. How you doing?
Good evening, Dr. Vanessa and Miss Lottie. Shannon, thank you for having me. I appreciate it.
Welcome.
Well, thank you so much for coming to talk about this important topic of having strokes, because right now we've heard so many cases of people having strokes now. I guess for different reasons, stress, pressure, whatever. So we want to try to get in as much information as possible tonight. So I wanted to really start with, I know there's 3 types of strokes. So could you tell us the three types of strokes?
Sure. So there are 3 types. There is ischemic, people know it as a CVA. There's a TIA, people know it as a mini stroke, really, and there's the devastating one, which is a bleeding stroke called hemorrhagic. Ischemic strokes, it's about 87% of strokes, and the bleeding strokes are about 15% of actual strokes. So the TIAs, it's a warning sign, right? You don't really have a stroke, but it comes and it goes. It's like your body's telling you something's about to happen, so it goes away. So we don't include that in our percentages, but it's very important to know these signs because it's your body's telling you that something is wrong. So those are the 3 types.
And that's interesting.
Right on.
That interesting that you mentioned the 3 different types, because people think there's just one type of stroke, right? Mm-hmm. And the thing is, when they think of stroke and they don't understand that things are going on, they tend to ignore them. They don't think, because they're not really familiar with what is a stroke. They kind of really sometimes associate a stroke with an older individual, like a grandparent or somebody that's sick or have some type of medical history. But it's not just those people that are vulnerable to stroke.
Oh, absolutely not. I work in New York Presbyterian system. I see about over 1,000 stroke patients a year, and they're getting younger. And when I say younger, I'm talking about 30s and 40s and 50s. And as Ms. Lottie Shannon said, stress contributes to it. Why? It's not just because we're stressed out. Our blood pressure goes up. And for the younger people in our can you imagine 30s, 30s and 40s, blood pressure, high cholesterol, they're eating, they're smoking habits. We all know cigarettes are bad, but it's hard because it's addicting. So yes, they're getting younger, and it's devastating, really. And that's why I want this message out, because we have to know how to spot those symptoms, what to do, what happens in the hospital, and what you need to do to get there.
Yeah, because when you was talking, about it, I was thinking, because I think that I might have fallen in the category with the mini, because I was sitting at my table eating one night, and then I finished and I'm sitting there, and all of a sudden my mouth started twisting, and I don't know why I just jumped up and went and started drinking water. I didn't even think about okay, well, let me call the ambulance and get to the doctor or whatever. I just started drinking a lot of water and stuff, and then I just calmed myself down, and then after a while it kind of went away. And so now that you was talking, I'm saying, well, did that happen? Was that what was happening to me then? That I might have been having something like that?
So a TIA, a mini stroke, it's your body telling you, pay attention. Your body's saying, Miss Lottie, pay attention to me. You're not doing something right to take care of me. And as I mentioned to you earlier before the show, our bodies, we're like our own homes. We have to take care of our body. Our arteries, they're plumbing, they're pipes. You got to make sure those pipes are clean. You have to make sure that they're functioning properly, because We don't want them to burst, like that's high blood pressure. We don't want them clogged up where it's kinked and the blood can't get through. That'll cause strokes, and not just strokes, really heart attacks. And we know how to take care of ourselves, right? But it's hard to do it. And so it's important. So Miss Lottie, Shannon, I know you're going to take extra good care of yourself after tonight, because I know Dr. Vanessa may come after you.
I'm always after her. Every show we have the same conversation. But you mentioned something that's unique, right? That a lot of people tend to ignore, and they don't really understand that blood pressure is a silent killer, right? It's not race specific, it's not gender specific. And when you talk about the young individuals that are having stroke and even heart attacks, they tend to ignore these common symptoms, and they may be common to them because anything that's in the thoracic area, right? They may associate it with just like gas or something, but there's a lot of systems that are there, and sometimes people don't understand the signs is when it's kind of cardiac related.
I agree. So, and at the same time, when back in the day, people didn't pay attention to stroke patients. Why? Because the strokes don't hurt. And high blood pressure doesn't hurt. It's just happening. Everyone paid attention to cardiac arrest, heart attacks. Why? Because they're coming in like it hurts, very dramatic and screaming. When a stroke happens, you don't realize it until you can't lift up your arm. You fall, you can't lift up your leg, and you're like, what's going on? And oftentimes they're left alone without being the full assessment back then, because they didn't complain. It doesn't hurt. And high blood pressure, the silent killer, 100%. I want to say out of all the stroke patients I've seen, over 95% of them have high blood pressure. I would even say 97% high blood pressure, almost always. And it's a problem. It's the young people have to address, probably another topic, really. But
see, the thing about that with the blood pressure, right? You don't even know that your pressure is up, because the pressure can be up, but you don't feel anything. Because I remember one time when my pressure was up real high, and I went to the doctor, but I went for something else. And then when they tested my pressure, it was real high, and they wanted me to go to the hospital. But I says, I feel fine. I don't feel like I'm dizzy. I wasn't dizzy or anything going on. So that's why sometimes I say it's hard with the blood pressure, because you don't even know when your pressure go up that high. Because normally I figure you would get dizzy or something, but you feel fine.
Not everybody, and that's why we have to educate ourselves. We have to go to our doctor's appointments. If you know you have a family history, talk to your family. If there's a parental or maternal family history of high blood pressure, check your blood pressure. Once you get a certain age, encourage the young children to start seeing their primary care and talk about your health, and make sure you keep those yearly appointments, because it's important. Because like you said, blood pressure doesn't hurt. And listen to your physicians. And if you don't like your physicians, get a new one. There's a million out there. They're not gods, right? They have to make you comfortable, just like you're comfortable with them, because your life is literally in their hands. So those doctor's appointments are very crucial, because they'll give you the picture to you. Then the rest is up to you.
But a lot of times, Kristine, when they give you the picture, they do give you the picture and all like that. But see, a lot of times they just want to keep giving you more medicines. Particularly, like say you got high blood pressure, they give you one. Okay, if it's not coming out, they want to give you 2. Then they want to give you 3. But then you taking all that high blood pressure medicine, and it's really just killing your organs and everything. So I mean, like sometimes you don't know what to do. Sometimes I'm not taking it.
But you know what the thing that, Lottie, when people first go to the doctor and they first diagnosed with high blood pressure, they normally by the second and third visit or cases, maybe suspicion you have high blood pressure. There's different classes and different doses of medication. So when doctors give you different classes, they find out what works best for you, what your body is most tolerable to, and there's different doses. But I just wanted to ask something, since we were talking about high blood pressure and people think that they don't use a lot of salt. They don't cook a lot of salt, but they don't understand is that a lot of ingredients, a lot of things, seasonings have a lot of salt, and these things add up. A lot of people eat outside. If everything is like a big fast food availability, the corner stores, the sandwiches, the McDonald's, all these things have sodium components to it, and these are all contributory factors.
Yeah.
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 And I wanted to add to that, and exactly what Dr. Vanessa said. It's kind of like the Goldilocks and the Three Bears theory, right? Everybody's different. You have to see what fits for you. One med may not work for one person, but it'll work for another. And it's not just the medication. Once the doctor's telling you, hey, you know, so and so, you have high blood pressure, you have to really be honest with yourself, and you have to say to yourself, am I exercising? Am I eating properly? Because if it comes in hand. So the medications are helpful, but you also have to help yourself in addition, because if you're not doing those other two important things, they may add on more medication because they don't know what to do. What else can they do? So it's a game. It really is like a balancing game.
So is there other, I mean, I know there have to be other signs. We know that blood pressure is one of the main ones. We know the twisting of the mouth could be a beginning. Like, is there any other things that we really should be watching out for to know that, you know, this could be a sign of a stroke?
Yes, weakness on one side, inability to move. Strokes almost always happen on one side of the body, where you can't lift your arms, your legs. Everybody is familiar with the face, your speech. Some people stop speaking all of a sudden, or they can't get the words out, or they're speaking nonsense words, and they can hear the words coming out of their mouth, but in their mind, it's like, what am I saying? So they get very frustrated. That's a stroke sign. And the biggest sign that people don't really know about is that sudden onset of dizziness and blurry vision, and even vomiting. You feel like you're in a roller coaster in your own house and the room won't stop spinning. That's a problem. People don't realize they have to go to the hospital to get that checked out.
Yes, Kristine, I know all these signs and symptoms of stroke. Can you let our viewers understand what is the acronym for stroke?
Yes, B FAST, BEFAST. Balance, eyes, facial droop, arms, speech, T for time. You got to go to the hospital. Don't play around with your life. You need to go there because it can be reversed depending on the time, depending on the type of stroke. There's medications for it. There's treatments for it. And at the end of the day, you can't play around with your life. You got to go to the hospital. Let them figure it out. You don't have a CAT scan in your back pocket. I don't think you guys do.
No, I hope not. Because who's using the AI? You don't want that.
Because sometimes you're not really, thinking. I mean, you know about what you're supposed to be doing and stuff, but sometimes you're doing what you're supposed to be doing, and things just still be happening. So I don't know if it's because the body had already been attacked so long or whatever until you can't do anything about it at that time. But I mean, it's like kind of scary. It's really kind of scary,
It is, right? As we get older, we're more self-aware, and sometimes that's scary. It's nice to be naive and young, but we're not. Maybe some of us. It is what it is.
How you said I'm not even old? Is that it?
You non-compliant, Lottie. We know you non-compliant. So
you already hear her like saying, so we can read through the lines, and I can read in between. And
okay, then we're gonna take a quick break. We're gonna take a quick break, and we're gonna come back and talk about more signs of a stroke and how we should take care of our bodies. We'll be right back.
It's Shannon. It's Shannon.
How you holding up? Nothing wrong with getting help.
If I promise to look into it, will you drop it and help me build this fence?
Now you need my help.
If you or a veteran you know needs support, don't wait. Reach out. Find resources at va.gov/reach.
We're back. If you're just joining us, we're talking about having a stroke. Every minute counts. I wanted to also ask the question about, I know we have to do prevention and, with the eating and the dieting, but you was talking about the arteries being clogged and all that. Is there things that we can do to make sure our arteries does not get clogged, or you can't?
Well, it depends. So there are things to help prevent it from getting further clogged. But once your arteries are clogged and your cholesterol is high, really at this point, if the diet isn't working and exercise isn't working, the next step is medicine. And some people have a hard time with medicine, but I always remind them, It's put here for a reason. We have medications. We're in a place where if you have good health insurance, you get medication, take it, because the alternative, the risks for that could be worse. And besides the diet, the exercise, medication, really, and that's something that should happen if diet and exercise are not working to lower your cholesterol.
Okay, I wanted to know what's the recovery time. People have strokes in different times, different types of stroke.
Yep.
Is it the longer the person can become rehabilitated and become more self-independent, is that longer for them to really fully recover?
Dr. Vanessa, everybody's quite different. And the reason why we're different is because we all have different backgrounds. We have genetics, we have different DNA. If you initially took care of yourself for a long time and you just happen to have a stroke, your recovery may be quicker. But if you already started off quite sick in the hospital, it takes you a little bit longer. It depends on, we call it neuroplasticity, how much of your neurons can regenerate to gain back some of that function. The rehab, like how much rehab you're able to tolerate. I've seen people leave the hospital in a week, but I've seen also people who months out. I also run a stroke support group, and I have very long-term stroke survivors there some of them have taken years to recover just to get up to walking with a cane, years. So everybody's different. I always give patients really about 3 months. If they haven't had a decent recovery in the first week or so, I'll say give it 3 months to see what your baseline is. Go to rehab, work at it. I check up on my patients 3 months after they had their stroke. I check up on them 7 days and then 3 months, just for that support, because it's devastating. It's it robs you.
I know a lot of people go through rehab. Do you recommend people doing rehab every day? Because sometimes your body needs a chance to recover.
I recommend
for the physical activity.
What I tell my patients and some family members, you do what your body can tolerate. You know yourself. You are your biggest advocate. You know your body. And that's why I always say, if you feel that something's wrong, whether you can't do something, be vocal. No one else knows your body better than you. And I always stress this. If you don't feel like your doctor's taking good care of you the way you're comfortable with, find a new physician. You need that relationship with them because, again, your life is in their hands. So the rehab, you do what you can tolerate because your body will tell you when it's time to quit.
Well, Kristine, I don't understand. This is something I don't understand. Now, I know some people, and I know somebody who's a health food person, health food nut. They eat all supposedly the healthy stuff. They don't be eating the ribs and macaroni and cheese and collard greens and all that kind of stuff with grease. They eat healthy. They exercise, everything, and they had a stroke. So I don't understand. I mean, I know people say like me, I eat the wrong thing. I know that. So I don't lie. I know what I do wrong or whatever. But people that's supposed to eat healthy like that. So then what's causing them to have a stroke then?
Genetic factors. And also you have to think, like, really ask them. So there's all these new meds, right, that make you lose weight, right? So you have to think about what's in the inside. So let's say somebody was really unhealthy before and now they're exercising and such. Their arteries still have that cholesterol and that plaque in them. We can't get all of that plaque out. Sometimes you can't, there's nothing you can really do once your arteries are very clogged. So, and in addition to that, somebody may have something called atrial fibrillation, just genetic risk factors that causes strokes, like an abnormal heart rhythm. Or some people just develop cholesterol more than others. Doesn't matter how slim you are, how young you are. For my own family, my younger brother, he was in his 30s when he had high cholesterol and hypertension because it was genetics. It's just in my family. It just runs in my family. And he was not a big person. He may have drank a little bit too much in college. However, he was just genetically predisposed to having high cholesterol and hypertension. So it's really important to know your family history because
so that's really real. It's just because your mother and father may have had high blood pressure that you would automatically get high blood pressure.
Yep, it's how we're built. We don't want to be built that way, right? But sometimes it's how you're built, and it takes a lot of just diet and exercise and discipline. It's hard because you said all those good foods, and I'm already thinking Thanksgiving because
Yes, But one of the things that's an issue sometimes is that families, right? They may be mom, let's say mom is the one who has high blood pressure. She may not be able to have, it may not be cost effective and affordable for her to make two pots, a separate pot for herself and a separate pot for the family. So sometimes they tend to kind of sacrifice themselves in order to appease the family. So what do you say to that in terms, I think maybe that mom in that situation can kind of teach and educate the family of a better way of eating, a better way of still getting the benefits of food, because that's what sometimes people do. They don't worry about themselves. They don't think.
Well, who gonna be cooking 2 pots of food?
No, people cannot afford that. So even diabetics, people who have medical conditions, they can't afford it. It's not cost effective for them to cook a separate, a certain type of diet for themselves versus their family. So they tend to sacrifice themselves.
Mm-hmm. I see.
What do you mean? I don't understand what you mean. Like, you mean just cook something for themselves? Because I don't understand why, even if you're a diabetic or whatever, you just cook the food without the salt and all that in it. They got
it's
salt
like you just said that.
Put the salt on there.
Kristine, you can explain that to Lottie because she's not compliant. I'm telling you.
You guys in the same room? I hope not. Because
Not tonight.
No, I see what you're saying. So number one, good food is expensive. There's a whole nother issue with that when it comes to getting the right access to the right foods. I think there's just a whole sadness about it. However, there are some ways to tweak your diet, and discipline is a big deal. And role modeling, right? Parents, when you're cooking for your children, yes, sometimes it's easier to grab that high sodium canned beans, etc. So you have to really kind of modify your lifestyle to teach your kids a certain lifestyle too. And vegetables, unfortunately, high in vegetables, they're expensive. And then there's a lot of like different ways to try to eat healthier. Sometimes I think like things are just against people with doing better for themselves. But there are different types of groceries that have low cost foods that are healthier. So the discipline is important, role modeling, because your children watch you, your neighbors watch you, and just getting your palate accustomed to eating less salt. Because once you're so used to eating that good food at salt and you start to wean yourself off from it, it's hard because food is addictive. Good food is addictive, so, and it's little by little. You have to wean yourself off of what's not good for you.
Absolutely.
Okay, so we know we're supposed to get off the salt. So if we completely get off the salt, which I don't think is possible, but I'm saying if we can just not be eating any salt at all, right? And also sugar, because I know sugar is a problem as well. So you were saying that we actually can kind of heal our body, ourselves, if we get off that
it's
stuff?
not just that. So that's not realistic to completely cut salt and sugar out of your life. That's not, because then you might as well just, I don't know, eat cardboard paper,
Because there's a recommended amount that even people with high blood pressure is recommended that they can
there
take.
is.
Well, my doctor told me just eat salad.
Just
the dressing you put on, you put the dressing on, and what do you eat a day?
I'm saying he did, because I was like, well, okay, so what are you gonna eat then? You can't eat anything, so he was like, well, just eat salad. You don't have to worry about anything or whatever,
But you got to move around. It's not just the eating part. Eating part is just one part of it. I do recommend, and because I've read about it, it's like what we recommend to everybody. After you eat, try to walk around your house. Get one of those stepper things, or even like a walking treadmill in the home. They're inexpensive. Some of them are $25. Watch TV or something, but move around right after you eat. It does wonders, really, just to move around right after you eat. So diet, yes, it's important, but so is exercise. And you'll see a difference. And the biggest thing is the discipline, because it's not easy. I 100% agree it's not easy, but what's the risks if you don't put that effort in? The risks of everything.
Well, I know earlier we spoke about, you mentioned some statistics, just before we close the show. Can you just let our viewers know how prevalent it is and what the statistics are with people having strokes?
Oh, yes. So in strokes, there's about 800,000 people that have strokes a year, which is a lot. And out of that 800,000, about, I think 250,000 or 300 have it for the first time. And in addition to that, time is brain. That's why you have to go to the hospital. For every minute that you're having a stroke, somebody loses about 1.9 million neurons. And depending on the genetics, we can get some of those neurons healed, but sometimes we can't. That's why it's so important to get to the hospital. There are treatments for it. They have medications to try to dissolve that clot. There's a procedure where you can try to get that clot out. Think Drano, think Roto-Rooter. We can dissolve it or we can pull it out. But you have to get to the hospital because that's very time sensitive. Once you're out that window, we can't do anything for that. So we educate. Stroke used to be the third leading cause of death in the US. Now it's the fifth because of education. I take any opportunity I can to educate the community and to teach them. And if was one thing that I want to drive home is your signs and symptoms. Come to the hospital. They will see you. Stroke centers are out there. There's the internet. Google what's around you. I'm welcoming everyone to contact me if they have more questions. And I just feel like spreading the word, getting there. I don't want to talk about what you need to do with your food and exercise because you guys know you don't need this show for that.
Okay, then, so we don't have to walk 2-3 miles. We can just go around the block and come back then. So that's good.
Yeah, but that's a start. And then don't let Dr. Vanessa look at you. She gave you that look. She gave me that look. You see?
Right. Okay, we're going to end the show and then I'm going outside. I'm going to walk around the block about 1 or 2 times.
I want a video.
Yes, timestamp. So we have a question.
How many minutes after eat? Walk how many minutes? She just said you can just walk around the block and come back. That's all. So you don't need to walk that long.
If you don't do that, usually I'm so proud that you're even thinking about doing it.
Absolutely.
See, I don't have a problem walking. I like walking. I don't have that problem. I just don't want to be jumping up with no aerobics and all that kind of stuff. No, I don't want to do that.
Walking is fine.
I don't want to do that, But this is serious. This is serious, and we need to get serious about it. I'm going to get serious about it because I want to be around for my granddaughter a little bit longer. So I'm just going to have to give up those greens and macaroni and cheese and all that kind of stuff. So we're going to do it together. So thank you so much for joining us tonight. Remember, you can watch us on Saturdays on Brick at 5:30 p.m. and on Manhattan Neighborhood Network at 2:30 and catch us every Tuesday night live here on Facebook and YouTube. So we want to thank you, Kristine, for coming on and giving us all the information tonight. And you have really inspired me to do better. And I know Dr. Vanessa going to do something too. She's going to do a little bit better also.
I feel like she's been trying to get you.
No, she ain't been trying either. Don't let her fool you. Don't let her fool you. So we want you to come again. So you'll come again and we can talk some more about strokes because it's very important. So thank you so much for joining us. And thank you for joining us tonight as well. And as always, we'll see you next time.
Today's show is sponsored by Abu's Bakery. If you have a sweet tooth, stop by Abu's Bakery for some delicious cakes and pies.
Would you like beautiful pictures for your home or your office? Then stop by Faith Art Gallery. They have a large selection of pictures from around the world.
It's Shannon.